Let's talk about injecting or shooting Suboxone. We already know that Suboxone, aka buprenorphine plus naloxone, is a great medication for opioid addiction. And it's taken sublingually, meaning it dissolves right under the tongue where there's some big veins that will absorb the buprenorphine really quickly. But why would someone inject Suboxone? Well, considering the fact that about 30% of buprenorphine is absorbed when taken under the tongue, versus close to 100% of buprenorphine is absorbed when it's injected IV through a vein, some people might be hoping to achieve a more intense high or get some more pleasure and euphoria by injecting. But does this actually work? Well, there's a few things to consider. One, buprenorphine is a partial opioid receptor activator, while most other opioids like heroin, fentanyl, and oxycodone are full activators. So any pleasure or reward you might get by activating those receptors with buprenorphine is not going to be as strong or intense. Maybe if you're opioid naive or your opioid tolerance is super low, you might get some pleasant high out of it. I've heard from others who report injecting that it is minimally enjoyable, and that's if you avoid precipitating withdrawal, which we should talk about next. 2. Suboxone contains naloxone, an opioid receptor blocker. The combination of buprenorphine and naloxone is meant to deter or discourage people from injecting because theoretically the naloxone is supposed to block the buprenorphine and it could precipitate withdrawal if you have other opioids in your system. But to be honest, the science doesn't back this up. Buprenorphine has a stronger affinity than naloxone for the opioid receptor, meaning it's stickier. And buprenorphine has a much longer half-life than naloxone, meaning buprenorphine will last in the system longer. Regardless, many people believe that naloxone being in Suboxone may prevent people from injecting it. Now, people do report precipitating withdrawal if they inject Suboxone, but this is likely from buprenorphine displacing other opioids, not the naloxone. 3. Anytime you inject something directly into your bloodstream, you risk getting infections and causing other health complications. You could end up pushing bacteria into your blood, which could spread to other parts of your body. I've seen a lot of folks in the hospital who had heart failure because bacteria latched onto their heart valves, causing something called endocarditis. There's also the risk of transmitting other things like HIV and hepatitis C. And of course, sometimes drugs are not pure. They're cut with other things that could be toxic, such as levimisol. If you have a history of injecting drugs, please make sure you're getting regularly checked for HIV and hepatitis C. Try to use clean needles and avoid sharing them. When it comes to needles, sharing is not caring.